Hey, what's up, guys? My name is Dr. Randy Thompson. Thank you for joining me at this month's healthcare forum. Today we're going to be going over how to use the foam roller, the stretch out strap, and how to use a tennis ball to help kind of relax your muscles, get things nice and loose and moving. And we're just going to jump right into it. A lot of my patients come in because they have back pain, neck pain, a lot of things that are caused by either sitting too much or because they have a very strenuous job. A lot of what we're doing today is kind of focused around that. I'm just going to jump right into it. I have four really great stretches that I love. These are basic stretches to help kind of loosen up the lower back. But they're counterintuitive because they're not for the lower back, they're for your hips. So a lot of times whenever we get back stiffness, it's because our hips are actually weak and you're not, or stiff or not able to, you're not able to evenly distribute the weight between your lower back and your hips. So when your hips are tight, you're going to feel a lot more in your lower back. So I'm going to show you four really great stretches right off the bat that are going to help to that you should definitely try to loosen up your lower back. So the first one, you're going to find an area to sit in that's either a couch or a table or like a coffee table or a bed or something like that where you can hang one leg off the side, but you can have one foot up straight. So the first one is a basic hamstring stretch. I'm sure you've seen this one a million times. You're going to reach forward and touch your toe just like this. You should feel it in the hamstrings, but it's also going to start to warm up the lower back. You know, we like to say that everything in the body is connected in one way or another. Your hamstrings connect to this ligament in this part of your hips called your ischial tuberosity. From there, you have a lot of your spinal erectors, those two big muscles on either side of your lower back. And that sling is connected. So when you start to stretch the hamstrings, it's going to start to help out with the lower back as well. So this is the first one. Leg hang off the side, leg up straight. You're going to reach forward and touch your toe. You're going to hold this for about 2 minutes. After this, you're going to bend your knee. You want your knee at about a 45-degree angle. Your foot is going to be a couple inches out in front of your lap. What I'm going to do is if this is causing pain in the knee, I want my knee flat on the table, but I'm going to still keep this other leg dropped off. What I'm going to do from here is first, I'm going to bring my chest straight down to my foot. I'm going to lean forward just like this. I'm going to feel it right on the side that the leg is on, towards my lower back. That's called your sacroiliac joint, your SI joint. It's where your tailbone meets the side of your pelvis. I'm going to lean forward. I'm going to bring my chest right to my foot just like this. I'm going to same thing. I'm going to hold it for about 2 minutes. If anything in your foot starts to go numb, it's too much. I want you to either reposition, try to find a new leg position, or maybe you're just leaning down too far. After that, you're going to keep your leg in the same place, 90-degree angle, foot a couple inches out in front of your lap. I'm going to rotate. I'm going to bring my chest down to my knee this time. The different angle that I'm using by bringing my chest down to my knee is going to work different things in the hip. So when I bring my chest to my foot, it's working more of the joint. When I bring my chest to my knee, I'm working more of the glutes. That's more of the muscle that's on top of the sacroiliac joint. I'm going to lean down here. I want to feel it on the same side. I don't want to feel it on the opposite side. If you're twisting too much, you might feel it on the opposite side of the lower back. So I'm going to lean forward. I'm going to bring my chest down to my knee. Same thing as the other two stretches. We're going to hold that for about 2 minutes. Those are the first three. The first three, you're on some kind of raised platform. The last one is you're going to be standing, but I want you to make sure you have something to hold on to. You're going to do a deep lunge. I want to get nice and low. What this is going to look like, I'm getting really wide. You can't see my front knee, but my shin is vertical right through here. It's hard to see. Let's do it this way. There we go. My shin is vertical. I'm getting nice and low. I want to feel this right in the front of my pocket, right in the front of the leg that's going back, right up on the top of the hip area. That right here, these are called your hip flexors or your psoas. This is a muscle that goes from your your femurs through your pelvis and actually attaches directly to your lower back. I'm going to show you what that muscle looks like. It's this one right here. So you see it's going from the lower back, and it's going right down to your femur. This muscle gets very, very tight whenever you're sitting for long periods of time, or if you're in the car for a long period of time, anything like that. It's a really great stretch to do to open up your hips. So get a nice, deep, wide lunge. Here's something I want you to look out for, though. If you get into this wide lunge position, I don't want you to feel it in your lower back. I want you to get it nice and deep. I only want you to feel it in the front of your hip. If you're feeling it in your lower back, I want you to lean forward just a little bit and go a little bit deeper. That should take some of the pressure off of your back and have it more in the hips. So remember, this muscle attaches to our lower back and to the top of my femur. So I want to be very careful with this one. This one could flare up your lower back just a little bit. So we want to make sure that while we're doing this stretch, it's comfortable. You have something to hold on to. It's not a balance exercise. You want to make sure you're stable while you're doing this stretch. Also, whatever you're holding on to, you want to make sure it doesn't have any wheels on it, that it's not going to roll away or anything like that. If you're getting too low, you want to make sure it's something you could push yourself up out of. I want all of these stretches to be very, very safe. So those are the first four stretches that I love to do. They're general stretches that are pretty good for about 80% of patients. If this is causing you any kind of sharp pains, if this is causing any numbness in the foot, anything like that, it's time to take a break. It's time to back off a little bit, either reposition, or if it's not working for you, come on into the office. We'll do an exam. We'll actually get you a diagnosis of exactly what's going on, so we can ensure that what you're doing is safe for you, and it's going to be productive. It's going to be something that's going to help your back. So next, we're going to get into the new products that we have in the office. I'm really, really excited about these products because I've been trying to get them for a very long time. We finally have them in. These are fantastic for a lot of people that have a lot of difficulty stretching on their own, that either can't get into the positions that I just showed you before, or it's very uncomfortable for them to do it. So this next product I'm about to show you is very gentle. It's something that a lot of people have been asking for. It's called the Stretch Out Strap. So let me show you what this is. It comes in this nice little carrying case, and it comes with a little guide to show you how to do it. So these are some of the things that we're going to be going over today. So you see how you use the strap to give you leverage to start doing a lot of the stretches that you couldn't previously do, either because of inflexibility or because of pain, or you need something that's a little bit more, it's going to be a little bit lighter on your joints. So what this is a strap that has multiple loops throughout here. So very rarely when somebody says something is one size fits all, it very rarely is, but in this case, because there's so many different loops, this really can fit just about any body size, any body type. So I want to show you how to do the same things that I just did, the same 4 stretches, but we're going to do them with the stretch out strap this time. So what we're going to do is you're going to put this around your toe. I'm going to lean backwards. I'm going to lay back. I'm going to make myself comfortable. I'm going to use a headrest. I'm going to lean back just like this. I'm just going to lift my leg just straight up. I'm going to pull until I feel comfortable, and I'm just going to hang out right here. This is a really great stretch for my hamstrings. If you put the strap a little bit closer to your toe, you're going to get a little bit more calf in there. If you put it a little bit closer down towards your heel, you're going to get a little bit less calf. So I'm going to stay here. I'm just going to pull it straight back. I feel it all through here. If you get any kind of numbness or burning or anything like that, it's too much. I don't want you to feel uncomfortable. All of these stretches should be very, very, I want them to be comfortable, but I also want them to be productive. So I want you to stretch until you feel it, but not so much that it's going to be uncomfortable and painful for you. So we're going to go straight back like this. This is the first one. The next one, you're going to go to the inside. When we go to the inside, I totally realize the angle is a little ridiculous. But when you go to the inside, you're going to stretch the outside of the glutes. When you go to the outside, you're going to stretch the insides of the adductors. So the glutes and the adductors, the inside and the outside of the hip and the pelvis, are one of the very common places that I hear a lot of people having quite a bit of pain. If you are getting pain around here when you're walking, so I have a lot of patients that get pain going shopping. They can't go shopping for more than about 10 to 15 minutes, otherwise they're going to get a lot of hip pain from whether that's a lot of times it's caused by stiffness. There's a couple muscles that go right on top of this outside part of your hip. Let me show you what I'm talking about. So you have this one muscle right here called your tensor fasciolata. Tensor fasciolata is attached to your IT band. Beneath that is called your gluteus minimus. Your gluteus medius is right around there as well, probably a little bit back further. But this muscle is right underneath your belt. So if you find your belt line, if you find the pointer of your hip, it's right behind there. It's a really tender spot to get to because right underneath that is your greater trochanter. Excuse me, your greater trochanter is right underneath there. So that part of the hip, when that muscle gets tight, it's going to snap over the kind of the bone. Let me actually show you. I'm going to show you an even better one. I'm going to go get a spine real quick. Let's find a spine. You're going to come with me. So right here, we have our spine. This is one of our other offices, or one of our other treatment rooms, by the way. So the muscle is going to go right along here, and it goes straight down. And if right here, when you're walking, it keeps rubbing up against this big process, this big part of your hip bone, it's going to be pretty uncomfortable. So if you get that rubbing feeling, if you get that feeling of a lot of stiffness and tightness when you walk on the outsides of your hips, then this stretch with the stretch out strap is definitely something that will benefit you. So again, putting it around my toe, around my heel, leaning backwards, and I'm dropping it all the way to the outside, and I'm going to feel it right all along here. Dropping it to the inside, you're going to get on the inside stretch, the adductors. If you notice that when you're walking, your knees are knocking together every time that you walk, it could be one of two reasons. It could be weakness in the outside of the hips, or it could also be tightness on the insides of the thighs as well. So we want to make sure that we're stretching out both. This last one that I'm going to show you, using the stretch out strap for your lower back, is the big reason that I really wanted to get this. I can't tell you how many people are unable to do this stretch. There's so many people that have such tight quads, they can't reach their foot. There's no way for them to even get to this position to stretch out the front of the leg. When you get tightness in the quads, because your quads go down and over on top of your kneecap, they actually insert right on the top of your tibia. So they go over your kneecap onto your tibia. That if you have tightness in the quads, it can pull back into the kneecap, and you can get a lot of knee pain from having tight quads. So if you're getting knee pain, if you're not able to reach your foot in that stretch that I just showed you, this one with the stretch out strap is absolutely fantastic. So I'm going to put this right over my foot, just like I did before. But in this case, I'm going to lie face down. I'm going to put this over my shoulder, and now I'm going to slowly pull closer and closer to get my foot as close to my butt as I possibly can. This stretch right here is something that in order to get that leverage and in a comfortable position like that, it's been something I've been looking for forever. I'm so glad that this finally came around. I'm so glad that we finally have these in and we have these available for sale. They're $14. It's a very so we got an initial batch earlier this week, and they're already gone. I had to save this one so I could actually demo it today. But we're getting a shipment in soon. We should have about 10 or so of them coming in. If you want to get on the pre-sale list, you can leave a comment right on this video, and we'll make sure that we reserve one for you so that when they do come in, they don't sell out right away. Or you can message us if you don't want to put it out in public or anything like that. But I love this thing. It's absolutely fantastic. Definitely give this a try when you get a chance. So it also comes with, like I showed before, the little demo packet. It shows you the stretches that we went over today. It also shows you a couple other ones for the upper back, for the shoulders. This one is for internal rotation. This one's for external rotation of the shoulder, going in these different directions. If this is uncomfortable for you, if putting your arm behind your back, behind your head is very difficult, very tight, you can use the stretch out strap for those as well. The next thing I want to get into is to go over the foam roller. So the foam roller is my personal best friend. I have a love-hate relationship with this guy. It's very tender using this, but because you're putting a lot of force into it. But we're going to talk about different ways to kind of modulate that to make it more pressure or less pressure depending upon what you're looking for. What we're going to do, so I'm going to move this table out of the way because I need a little bit more room. So I'm going to move the table out of the way. I'm going to show you guys a whole bunch of different things to do with the foam roller. So I actually taught a foam roller class for about 3 months while I was at this gym called Pacific Health Club. It's in Syracuse. Definitely go there. Fantastic gym. They got a CrossFit gym inside. They have, I think like 80 yards of AstroTurf. Really great gym, Pacific Health Club, if you get a chance to go there. So I used to teach foam rolling classes there. So what we're going to do is the purpose of the foam roller is to get pressure into the muscles. When you get pressure into the muscles, essentially what you're doing is you're squeezing blood out of the muscles. When the blood leaves the muscles, it takes metabolites, waste products, a whole bunch of stuff that kind of builds up in the muscles. And then when you let go, new blood comes in, bringing in nutrients and minerals, a whole bunch of stuff that your muscles need to start healing faster and to start feel better. So what we're going to do is we're going to systematically search for tender spots in the muscles. When we find those tender spots, I want you to dig into them. Kind of like think about what happens when you go get a massage. When you go, last time I went and got a massage, the massage therapist finds a tender spot. What did that feel like when they found the tender spot? It hurt. And when it hurt, what did? They just dug into it until it started to feel better. This is what we're going to do the same thing with the foam roller. It's never going to be the same as an actual massage therapist. An actual massage therapist is going to find exactly what's causing your pain. They're going to get right to the source of it. They're going to dig in there substantially better with much more precision than you're going to get with a foam roller. But this is close. This is great for daily maintenance. And so that's what we're going over today. We're going over how to use this for daily maintenance. So what you're going to do is you're going to start from the ground up. So I'm going to start with my calves. I'm going to start by just kind of going back and forth, kind of like windshield wipers. So I'm going back and forth. I'm going to start by my heels, and I'm slowly working my way up. If you're having shoulder pain, putting your hands behind your hips, I want you to lean forward when you're doing it. It's a little bit more uncomfortable, but it's going to be much more comfortable on your shoulders by leaning forward like this. I'm going to put them back here because I am fortunate enough to have shoulder mobility. I'm going to start going back and forth. And as soon as I find a tender spot, so I just found a tender spot right on the inside of this one, right here. So I'm going to put one leg over on top of the other to get some added pressure. And I'm going to point. Shoes are making it difficult to see what's going on. You can do this with shoes, without shoes. It's totally up to you. Nobody else is here. I'm taking my shoes off. So you can point and flex. And what that's going to do is that's going to make the muscle go back and forth over the foam roller. It's almost like you're sawing the muscle back and forth. So the skin stays in place, but the muscle gets pulled back and forth over this foam roller. And this is a really, really great way to get a deep massage, to get things moving. So I'm going to start right here. I'm going back and forth. I'm just going to go to the next spot. I want you to find at least 3 different spots. I want you to find at least 3 different spots per muscle. My right side is a little bit tired today than my left. So you're going to find about 3 different spots, and you're going to just point and flex anywhere from 5 to 10 to 15 times, depending upon how tender that spot is. If this is your first time doing it, I want you to find a spot low, a spot in the middle, and a spot up top towards the bulk of the muscle. If you've done this before, you kind of know where your tender spot. Right here. If you know where you've done this before, you're gonna know where your tender spots are. But yeah. So what we have a saying that we like to use. We say, "Seek and destroy." So you're gonna look for all those tender spots, and as soon as you find one, you dig that sucker out of there. Just keep working that foot back and forth. As soon as you've done it a couple times, same thing. Find a new area. So a very common area that a lot of people have pain is on the inside of the calf. On the inside right through here, there's this muscle behind your shin called your tibialis posterior. A lot of people can get some heel pain actually because of this tibialis posterior. So the way to find it is you're going to find your shin, the bone of your shin. You're going to go drop right to the inside, right where it drops off. You're going to go underneath there. Oh man, so if you're a runner or if you are on your feet all day, this is going to be really tender. So you're going to start all the way at the top and you're going to work your way all the way down the inside, all the way down to the ankle. And that muscle is a large muscle. It's all through the back through here, and you can get pain all the way down to the foot from the tight muscle right here. Very, very commonly overlooked muscle, but definitely should get some of your attention when you get a chance. So those are the calves. After we've done the calves, the next thing that we're going to work up to is we're going to work up to the hamstrings. So the hamstrings, I prefer using a tennis ball for the hamstrings. But when you don't have a tennis ball, a foam roller will do. What you're going to do, same thing if you're having shoulder pain, lean forward for this one, but it's a lot easier to do it if you kind of lean back like here. I'm just going to roll all the way back. I'm going to go right directly from the back of the kneecap. If you feel a pulse, you're on an artery, you don't want reposition so that you're not on an artery anymore. So start at the back of the knee and slowly work your way up all the way to your glutes. I like doing one at a time because I can kind of bend this other knee and it's going to help me move a lot easier. But same thing, I'm going to roll to the inside, roll the outside, find those tender spots, and then just dig in with that foam roller. So you're going to do same thing, about 2 minutes per leg on either side. Once you're done with the hamstrings, you're going to keep going, and you're going to roll all the way up to your glutes. So your glutes are a very, very wide muscle. They go all the way from your tailbone all the way to your pocket. So you want to make sure that while you're getting your glutes, you're rolling out to the outside as well. So we want to get out through here, right around the belt line, right around your pocket, in through here. This is a really, really tender area for me, but if it's a tender area for you, that means that you're going to get some pain and soreness in the future. And this is how we prevent it, by doing some self myofascial release, trying to relax these muscles, get all the tenderness and scar tissue and all the spasms, get them out of the muscle. So for this one, you're just going back and forth. You can do little tiny circles. But if you feel something sharp, remember we talked about the greater trochanter, that thing that your tendons are kind of snapping over. If you feel something sharp, it could be on a bony, kind of prominent area that's a little bit closer to the surface of the skin. This should be uncomfortable, but it shouldn't be sharp. The pain that you're feeling should feel like a dull ache, like a pressure, not like something that's like jabbing at you or stabbing at you, So those are the glutes. We want to make sure we're getting both of them. Next one is going to be the quads. So we talked about how to use the stretch out strap to really kind of loosen up the quads. This next thing that we're going to be doing is how to kind of massage them and get them to loosen up. So what I'm going to do is I'm going to start right above my kneecap. You never ever want to put direct pressure on your kneecap. You want to put just a little bit above there. So I'm going to go right above my knee, and I'm rolling all the way to the inside and all the way to the outside. Your quads are a very deceptively wide muscle. Your quads go from the inside of your thigh, right along here, all the way to almost like halfway behind your thigh. So do you see the middle of the seam of my pant leg going right through here? My quads keep going all the way to here. This right here is where the outside of my quad ends. It's almost like hamstring. So like this is the center of the seam. It keeps going. Make sure we get this whole area. This is a very often overlooked area that has a lot of tender spots. So we really want to make sure that we're diligent about getting all of those tender spots out of there. So we're going to start, like we said, right above the knee, not putting any direct pressure on the knee, all the way to the inside, all the way to the outside. You're going back and forth. And as soon as you find the tender spot, which there will be a lot of, you bend your knee. Just like this, about 4 or 5 times. If you're feeling nauseous, lighten up. It doesn't have to be that, intense. But I'm only doing one leg at a time. If I do both legs at the same time, I'm going to hyperextend my back. I don't want to do that. So I'm going to drop the other leg off the side. I'm going to put my stomach on the ground, maybe my forearms right like here. This is a much more comfortable position. If it's too much pressure, I can kind of lean away from it. I don't have to put my whole body weight, into my leg like this. So I'm starting here. I'm slowly rolling up higher and higher until I get towards the top of my hip. Every time that you're finding these tender spots, bending that knee back and forth. So like I said, get all the way, oh jeez, you're getting all the way to the outside. Super tender, but it's worth it because it's going to feel amazing afterwards. It's going to feel very, very, it's going to feel loose afterwards. But at the moment, it hurts like hell. I'm not going to pretend like it doesn't. I am not a tough guy. And I'm not going to pretend to be such. So what you're going to do is you're going to do about 2 minutes per muscle group. You need 2 minutes on the calves, 2 minutes on the hamstring per calf, 2 minutes per hamstring, 2 minutes per glutes, 2 minutes per thighs. If you do your lower body plus the stretches that we talked about, that's about a 20-minute routine. That's a really good 20-minute morning routine to kind of just get your lower body moving, to get your lower body loose. But if you want to add something to it, you can also do this on your lower back. So I'm just going to lean backwards. This position, when I'm leaning backwards, can put a lot of strain on my neck. So if that's painful for you, what you're going to do is just support your head. Use your hands to support your head. And I'm going to lift my hips up off the ground, and I'm going to roll. There's some spots up here. You're going to roll all the way from the lower back, and you can go all the way up to the upper back. It feels so good. What you can even do is, if towards the mid-back, towards the rib cage, you can let your hips sit on the floor, and you can just extend back over this. This feels like a really nice stretch all through the mid-back. If you're at a computer all day and you're kind of hunched over that computer and your shoulders are rounded forward, this is going to be really, really great. This is going to feel great for you. But, like we were talking about, if that's just too much pressure, if that's really hurting, I want you to go up on the wall. So what you're going to do is you're going to find this spot on the wall where there's no pictures or anything like that. I'm just going to put some pressure in. I'm just going to bend my knee just like this. It's much more gentle than putting your whole body weight into it. You don't have the luxury of being able to roll up and down, but you can kind of, explore, go up a little bit at a time, find where those tender spots are. This is much, much more manageable for somebody who's doing this for the first time, who's in a lot of discomfort when they're doing this. Because I want this to be comfortable for you. I don't want this to be something that, you're going to not enjoy. And when you don't enjoy it, you're much more less likely to do it. I want this to be more of a daily practice for you. I want your morning routine to be something where you're getting limber, you're getting loose, you're getting ready to go enjoy your day. So give those a try. Let me know how they go. If you're experiencing any kind of numbness, any kind of sharp pains, or any of that's happening, reposition. If it's not going away, if it's not getting better, please come on into the office. Let's take a look at you. Let's make sure there's nothing more ominous going on that could be also causing your pain. So those are our 2 new products that are in, but we have one more that the shop is actually stuck in China right now. And it's killing me because I love this for neck and shoulders. We just spent this whole amount of time going over lower back. I really want to find something that's, I really want you to have something that's good for your neck and shoulders. And this, the Theracane, is exactly that. And I know it's a mirror right here. Let's see if we can turn it around. There you go. This guy is freaking great. So this is how you use it. You're going to put this, the hook, the point of the hook, you can put this in your shoulders, you can put it in the back of your neck, you can put it right along the sides. There's so many people that have so much tenderness right through there. I really want you to have something that's easy, that's going to be able to reach there. So see how her arms are in front of her? She can put a lot of leverage. She can push down and get a lot of leverage right into all those spots in the shoulders and the neck and stuff like that. So this one is kind of just a nice image we found online. This isn't the one that we're selling. We're selling this one. This one is a lot smaller. It can fit into your bag. You can take it around with you everywhere you go. Your kids aren't going to be able to use it as much of a weapon as they will as this, but I like this one a lot better. It's much more simple. So when we get this in, we're going to demo this one too. But for the meantime, I want you to just imagine all of the pain relief that you could be getting from that for when we eventually do get it in. So, so we have quite a bit of time left to go over a number of other things that questions that we've been getting from a lot of different patients. So one of the questions that I get a lot often is I'm getting headaches, but my neck is stiff, and I'm wondering if I should get an MRI or a CT. Did I get I was recently in a car accident? Do I have a concussion? Anything like that? Like why am I getting these headaches? But they're, I don't know, but you get the gist. So there's this diagnosis called cervicogenic headaches. That means headaches that are coming from your neck. And I've been having a really tough time explaining kind of why this is happening to patients, but I finally found a really great way to explain it. So we have this excellent chart that shows you if you have trigger points and tenderness all through here, this is the referral pattern that you're going to have. So if you have tight, this is the side of the neck. This is right through here. This are pretty not exactly the same thing, but they're pretty much the same thing. Different muscles, but they're in the same region. If you're getting stiffness and tightness right through here, you can get headaches that make this kind of question mark pattern. You can get pain that feels like it's like right behind your eye or right along like the side of your temple. And that's actually coming from your neck. And it's so counterintuitive. You never think, how could something that's going on in my neck be causing pain somewhere else? And so this phenomenon actually happens in a variety of other areas of your body as well, and which I'm sure you've heard of too. A lot of people have heard that if you get a heart attack, you're actually going to feel it on your left arm. Why does that happen? That makes no sense. There's nothing wrong with my left arm. There's something wrong with my heart. But the pain fibers in the muscle of the heart are actually shared with the skin fibers of your arm. And so we actually have this nifty little chart called the vertebral that matches up. Is the vertebral nerve chart. It matches up the different organs to where different spinal levels on your body are. So the nerves that are going on in your heart are actually coming from your T2 spinal region, which is right there. That's right below the base of your neck. That's the base of your neck. That's where your neck ends, and that's where your rib cage begins. And your heart is actually matched up right with there. And so when a lot of times you'll hear chiropractors say that they can fix your liver, your kidneys, your stomach, or different things like that because the nerves coming from your back are actually going to your organs. So, how does your heart beat? How does your heart know to beat? Your brain tells it to, right? There's nerves in your heart that make it pump. You don't tell your heart, you don't say heart beat. Your brain just does it. And the way that happens is through the nerves. And so every organ in your body is controlled by these nerves. So if your spine is out of alignment, the amount that alignment, that misalignment is affecting your organs is the amount that an adjustment can fix some of these visceral, some of these gut problems. But if you're eating a lot of greasy foods and you're eating a lot of garbage and stuff like that, if your spine could be in perfect alignment and you still have all that stomach problems. So that's, in that case, it's not the cause. If your spine is like really out of whack, like bad scoliosis or something like that, it could be really pinching off the nerve and causing a lot of these organ issues going on. But it's not always the case. It's not. So if you're going to a chiropractor for say asthma or something like that, and you get adjusted and it's not helping, that might not be the cause of your asthma. And I'm okay with that. I'm okay with sending you somewhere else to get fixed by an asthma specialist. But in certain situations, your spine can get out of alignment and it can affect your different organs and stuff like that. Let's talk about other stuff. I had a question from I got nothing. I don't know. Let's talk about spine stuff. Let's go look at that spine again. So I love the model spines because they can give you more of like a very kind of real sense of exactly what's going on in your body. So let's orient ourselves first. So this is the front. I think you can guess which is the front of the spine and which is the back based on the pelvis. So this is your tailbone. Your tailbone's going to the back of your pelvis. This is the pelvic basin, the front of your pelvis. And I bet you noticed there's a little red guy. What's that little red guy doing in there? So in between each vertebrae is a disc. And each of those discs is made up of two different structures. The outer layer, look at this model. The outer layer is made of a dense connective tissue. It's called the annulus. The inner layer is this jelly-like material called the nucleus pulposus. If the jelly gets out of the jelly donut, it can push on the nerves. And that's what we see going on here with this one. You see the jelly is starting to escape the jelly donut. Now this jelly material is very, very irritating to the nerves. It is a very inflammatory material. And if it escapes, that's a big problem. So this right here, this is a healthy disc. This is somebody that's either, in their 20s, that's pretty athletic, or somebody in their 60s that has been taking really, really good care of their spine. This one's the next level. There's not much difference. But the one difference that we do see is the height of the disc is smaller. You see that this is a big, plump, thick, healthy disc. This is slightly smaller. And you're thinking, what's the big deal? It's only a little bit smaller. But between each of these discs is a nerve that goes right here. And so when the disc shrinks, the space that the nerve has to come out of gets smaller too. So when this starts to shrink, you're going to get more pressure on the nerves. You're going to get more likely to have sciatica. You're more likely to have numbness in the legs. You're more likely to have a lot of other kind of nerve complaints, like different other kinds of tenderness and stuff like that. So if your disc height shrinks, you're more likely to have a lot of nerve symptoms. And so the best way to hydrate the disc and to get that disc to grow and get plump is movement. So the disc, any kind of dense connective ligamentous tissue like this, does not have a lot of blood flow going to it. This is a fairly, so whenever you hear of getting ligament damage, it's going to take a little bit longer to heal compared to, say, a muscle injury. So your muscles are bright red. They have a lot of blood and a lot of oxygen in there. And that blood is carrying a lot of minerals and nutrients, a lot of the good stuff that your body needs to heal. But when this disc does not have the same kind of blood flow going to it. So instead, what you got to do is you got to move. You got to stretch in the morning. You got to stay active throughout the day. 8 hours of sitting at work is not good for your back. You want to make sure that you're taking frequent breaks in order to get up and move around and stuff like that. That's going to help you get more hydration and more nutrients to your disc. And this can be reversed. It's very rare that that happens because the actions that cause this to go like this are very hard to be reversed as well. So if you're sitting for 12 hours a day, it's very unlikely that all of a sudden you're going to turn into this super active person. But it's when it's done and when it's done well, there can be pretty impressive results. So there's always hope for people that are having this dehydration of the disc. Don't think that it's a life sentence. Don't think that you are out of control or that you have to go get surgery. Many times that's necessary, but there are many things that you can do at home and here in the office that we can prevent those surgeries from happening. We can rehydrate the disc and get you more space for your nerve to move around and be happy. So if you go from this to this and there's no improvement, the next kind of thing that happens is you get to this area. You start to get even less disc height, and the bone, the end plates start to kind of degenerate a little bit. You get these kind of craggly areas. You get this this rough, jaggedness to the bone, and a lot of people will have X-rays that look just like this that are that think that it's a life sentence. But luckily, this is even this isn't a life sentence. Even this, you could still get some improvement from. So this particular disc, I love this disc because it shows you what a disc herniation kind of looks like. So you see how there's multiple layers of the annulus. There's multiple layers of of connective tissue going around. It has to get through a lot of layers to have a really, really significant disc herniation. But there's times where it only goes maybe like a fraction of an inch, like only a couple millimeters. That's all it takes. Only a little bit of pressure on this nerve, and you can already get some pretty hefty symptoms. But not all of those. Just because you're getting those symptoms doesn't mean it's not reversible. So the inflammation is irritating to the nerve, but it's not. It doesn't have to. It's not a life sentence. It doesn't stay that way. So you see how. But this is a physical object. This is something that it's not magic. It's not nothing that's this thing that you can't understand. This is a physical anatomical structure, right? You have the outer layer that's thick and tough, and you have the inner layer that's kind of jelly and is trying to escape. If I push down here, I can push this back in to the center of the disc. I can actually start to heal the disc by getting pressure off of the outside of the annulus. I can push this back into it, get pressure off the nerve, and I can slowly start to let this heal. And there's a number of exercises that we use that can start to push the disc back into place. And physical therapists have been using this for years. Chiropractors have been using this for years as well. Adjustments help putting that into place. So, if you come to the chiropractor and you get adjusted, that can be very, very therapeutic for people with herniated discs. But there's exercises that you can do as well that will push that disc back into place to help get pressure off the nerve. So don't ever feel like you're not in control of your body. You are always in control of your body. There's always something that you can do to benefit you. There's some times where yes, you will need surgery. Or yes, you will need chemo. Like there's nothing that I can do for cancer. Like I'm not going to pretend like I can fix that. You see a lot of stuff online about certain diets and certain stuff like that. Don't mess with cancer. Don't do any of that stuff. Anyway, but if you have a herniated disc, it's not a life sentence. I treat herniated disc in this office every single day of the week, except for Sundays. I'm not here on Sundays. But there's exercises, there's stretches, there's adjustments that we can do that can help to put that disc back into place, take pressure off the nerve, and get you pain-free. I have a herniated disc right now. I have a herniated disc right now in my lumbar, right the. I'll show you. Not this one, not the one, but the one below it. So the one where you see right here, that's the L4, L5 region. I have it right below that. I have it right from the L5 area to the tailbone. That disc is herniated on me right now, and I'm fine. I just ran 4 miles with my wife a couple weeks. How long ago? I don't know, like a week and a half, something like that. I ran 4 miles the other day, and my back is fine. I can lift very, very heavy weights off the ground, and I'm fine. And I have a herniated disc right now. So, but there's people that tell you that that's not the case. That if you have a herniated disc, that you have to go get it fixed. You have to get surgery. So what happened in the 70s, what they would do is they put MRI machines on the back of a flatbed truck, and they drove around from town to town to town to town. And anyone that they did an MRI on that had a herniated disc, they give them surgery. And you know what happened? It didn't work the majority of the time. A lot of times, people that had herniated disc, they had no pain at all. There was no problems. There's this really, really great chart. I'm going to share it in the comments afterwards that shows all of these different asymptomatic conditions. That if you can have a labral tear in your hip or in your shoulder with no pain at all. You can have a herniated disc with no pain at all. You can have meniscal tears in your knees with no pain at all. And if there's no pain, just because it might degenerate a little bit faster, but that doesn't mean that it's not a life sentence. You can still do stretches that are going to maintain the health of your joints. But if you're it's never something that there's the vast majority of the time you don't need to get surgery, and the vast majority of the time surgery is not the best option. You want to start with the most conservative option first. You want to start with something that's going to be the most gentle, the least risky, and something that's that you can do on your own to help fix yourself, to help maintain the health that you already have, and prevent any kind of surgeries and stuff like that. So we work with a lot of surgeons that love chiropractic, that love physical therapy, that are going to send you out to go somewhere else before you need surgery. But there's other surgeons that that Shannon, doing more surgeries because they get more money for it. And that's what we kind of live in today. We live in this fee-for-service system where if I do something to you, I'm going to get paid for it. And so you have a lot of patients that ask for, give me the drugs, give me the surgery, give me something. Because if I walk in and they're like, oh, you don't need it, and you leave, they feel like they haven't been heard. But a lot of times that's the right option. A lot of times you don't need the surgery. You don't need the medications. All you need to do is go stretch, start moving, improve blood flow, and let the body heal itself. So our healthcare forum goes until typically go until from 6 until 7:30. I'm going to end it a little bit early today. If you have any questions at all, go ahead and leave something in the comments. I'll be sure to answer it, or one of the other docs at Boz Family Chiropractic will answer your questions for you. If there's anything I can do for you all, don't hesitate to ask. Come on in. We'll do our best to fix you up. And if we can't fix you, we will send you to someone who will. That's all for today. Let me show you one more time. I'll show you the stretch out strap and the foam roller. Let's go check those out real quick. So, stretch out strap is $14. Where's it going? There you go. Stretch out strap is $14. Foam roller is $14. If you get them both, $23. Big discount. So come on in, get these before they run out. We're already on our second order for them. And reserve yours today. That scared the crap out of me. I'm going to be honest. I shouldn't swear, but that was terrifying. What that's called is this is a drop mechanism. So there's a drop table. If I lift this up, it causes a little like a microscopic increase in the height of here. And what it does is that eventually, if I put enough pressure on here, come on, it'll release. I know you didn't see that, but when there's somebody laying on top of it, you need the amount of pressure. What this is it's just, watch how high this goes up. That's it. That little tiny bit. That little fraction, like a couple inches is all it needs to increase the speed of my adjustment. There we go. And help put your hips and your lower back into alignment. We love using that here. All of our tables have drop mechanisms. If you have questions about that, leave that in the comments too. I'll answer that later on today, or we can do a Facebook Live about that next time. We'll go over it then as well. Well, I hope you enjoyed everything today. If you have any questions, come on in, and hopefully we see you soon. Have a great day. Bye.